The early stage of labour is often referred to as the latent phase. This is when your body will start to make the necessary changes to allow you to birth your baby. The latent phase is different for everybody. Some women will not have one at all, for some it will last a few hours, and for some women the latent phase may last a few days. Each of these timescales is completely normal, and the changes that occur do not necessarily happen in a set order. It is important to note that your baby should continue to move the same amount right up until they're born. If at any time you're concerned about your baby's movements or they're reduced, if you have any bleeding, or if you are not yet 37 weeks pregnant, please contact the hospital that you're booked under straight away.
While you have been growing your baby, the cervix, or neck of the womb, has been plugged by mucus to protect the uterus from bacteria, keeping the womb a sterile environment for your baby to grow safely. One of the first changes you may notice is that the mucus plug or show may begin to come away. This can happen as the cervix begins to soften, thin out, and open. The show can appear like brown, pink, or slightly red-tinged mucus, which has a snot-like consistency. Some blood in the show is normal, but if you notice that you are losing fresh red blood, please contact the hospital that you are booked under so that a midwife and doctor can assess yours and baby's well-being. The show can come away a few weeks before labour begins and isn't always a sign that your baby will arrive imminently.
Tightenings or contractions of the uterus can start in the later stages of pregnancy. They're often painless and they're called Braxton Hicks and aren't really labour contractions. For some women, Braxton Hicks can be an intense sensation that if you're concerned at any point, please call the hospital that you're booked under so that a midwife can review you and your baby. When tightenings begin, they are often infrequent and irregular in terms of how long they last and how strong they feel. You will notice your abdomen going hard during the contraction and softening again when it's finished. During the latent phase, tightenings will become longer and stronger and more regular until they last about 1 minute and are coming every 5 minutes. It's a good idea to call your midwife or the hospital at this point for assessment and to make a plan about when to come into hospital or when your midwife will come and see you if you're booked for a home birth.
During the latent phase of labour, you may find that your waters break. This is the release of fluid that has been surrounding your baby and keeping them sterile and safe inside of your body. Waters can break in a gush or can leak slowly. It is a good idea, if this happens, to put a maternity pad in your underwear and call the hospital you are booked under. The midwives will want to know the colour of the waters and an approximate time that they broke. Waters should be a clear or slightly pink colour. If you haven't started having contractions 24 hours after your waters have broken, then the midwives and obstetric team will want to discuss a plan for induction of labour. Remember, your baby should still be moving as normal even when your waters have broken.
It's difficult to know how you will feel during the latent phase, especially if this is your first baby, and it's a good idea to have a few different strategies to try during this time. Many women who have used hypnobirthing techniques can begin to use them during this phase. Other forms of meditation and yoga have been used by women to good effect. It's also important to try to concentrate on your out breath. If you can imagine that you're breathing out a golden thread, try to breathe out a long, steady breath that wouldn't break the golden thread. It will really help to keep you focused.
Paracetamol is safe for both you and baby in labour and can be very effective during the latent phase. Heat packs, hot water bottles, and massage can also help you to relax. If you have a birth partner, it is worth practicing massage techniques before labour so they can get used to the type of touch and pressure that is helpful for you. Distraction can work wonders. You could have a bath, watch a film, go for a walk, or try and rest. When resting, lying on your left side is a great position for both you and baby to relax in. Listen to your body and remember, the latent phase can be trial and error when finding techniques that work for you.
We know that during the latent phase of labour, the best place for you to be is at home. If you're invited into the hospital to assess the stage of labour, you may be asked to return home and call back when your labour has progressed slightly.
These signs of early labour can happen in any order. You may get all or very few of them. Remember, keep a focus on baby's movements. Call the hospital or your midwife when your waters break or when you are contracting every 5 minutes or at any other time that you would feel you would like to speak to a midwife.
Whilst we endeavour to provide safe care for you and your baby during the pandemic, we have had to take the difficult decision to restrict visiting on the wards. This is being reviewed all the time in line with the best guidance we have available, so we recommend that you check the Trust website for up-to-date information. We know this may cause you some concern, so we have taken the opportunity to talk with some of the parents on the ward, and they have given us the following advice.
It has been suggested that you may want to consider bringing a separate postnatal bag which you can take to the ward, containing toiletries and clothes for you and your baby. Although healthy snacks are freely available, we appreciate that you may want to treat yourself to the occasional less healthy snack. We do have vending machines, but you may want to put a selection of these in your bag.
There is good internet connectivity, and some parents are choosing to bring in their devices from home so that you can stay in touch with your family and friends or watch a film. We suggest you bring in your earphones if possible and are considerate of the shared space.
It has also been suggested that you bring your watch if you have one. Some of the service users have reported getting distracted by lots of messages if they look at their phone for a quick time check.
Please remember to leave the car seat at home. Your partner or friend can bring this into the hospital when you're discharged. It's usual for the discharge to take place in the afternoon, so you may need to make some adjustments to your plans to accommodate this.
The feedback we have had has been positive. Please remember, the midwives and support staff are there to provide care and kindness in this immediate postnatal period. We understand that you may be feeling a little vulnerable, and we will do our very best to help you feel comfortable in your surroundings.